This is a question I get a lot. I mean, I've spoken a lot about training overhead throwing athletes, and it's the logical question, why don't you do overhead work? It's part of their sport. You have to expose it to them. I have two responses to that. And the first one is, I train a boxer, but we never kick him in the head during training. I mean, it just doesn't work out well. So beyond that, what other things do we have to look at? First, all of them have labral fraying. There's going to be less mechanical stability. It can be a shallower kind of contact area. Gird, we're dealing with a non-neutral humeral positioning. So my overhead pressing, as a guy who had a history of overhead throwing, it might be different than any of you who never played baseball growing up, or the European soccer players. Remember, approximation and traction are different. Throwing a baseball is a traction stress. Overhead pressing is approximation. Okay, so different kind of stresses on the joint. You get a high incidence of partial thickness cuff tears, particularly with supraspinatus, but you also see it in infraspinatus. A lot of guys will have very kind of barnacled up subscapularis issues. Most of these guys spend their entire life looking at home plate as they throw a baseball. What is that? It's cervical hyperextension. Okay, so they spend their life in forward head posture. That's going to affect how well we move our scaps. I also concern myself with Olympic lifts, stress on the UCL, wrist, forearm, hands. So that's my big concern with them. So retroversion, we talked about a little bit earlier. No exercise is going to change bone structure. So there's people that talk about how it may actually be an adaptation that spares the anterior inferior capsule from excessive stress during that external rotation. My feeling is, relative to this discussion, it's another one of those examples that talks about, hey, it's just not the same neutral head positioning that we talked about. Maybe normal for them, but not normal for an overhead press. This feeds into the discussion during the Q&A where we talked about sulcus signs. Bigliani did a study that found that 67% of pitchers and 47% of position players at the professional level have a positive sulcus sign in their throwing shoulder. It's definitely an adaptation to impose demand in some of these guys, but what they found was researchers also looked and showed that 89% of the pitchers and 100% of the position players with that positive sulcus sign also had it in their non-throwing shoulder. So if you've got it, there's probably a pretty good congenital component to it as well. So we're not just talking about modifying for pitchers, we're talking about modifying for position players as well. And this kind of feeds into the whole process of natural selection. A lot of those guys are throwing baseballs hard because they picked the right parents, picked the right sport too.